Just a few weeks ago, the World Health Organization declared monkeypox a public health emergency. This comes amid continuing cases of COVID-19, which raises the question, are we facing yet another global pandemic? Here to explain more about monkeypox and how to prevent its transmission are Dr. Trish Perl and Dr. Ikwo Oboho, leading experts in our infectious diseases division. Thank you for joining us. Dr. Perl, what causes monkeypox?
Monkeypox is caused by a virus of the same name. It is a member of the orthopox virus genus and normally lives in rodents and small animals. It's related to smallpox, but I want to remind them that smallpox has been eradicated. We probably have an underestimate of the number of cases that we've seen worldwide. Overall, it has a mortality around 3%. With this most recent outbreak, we have over 36,000 cases in 78 countries with 5 deaths that have been reported.
Dr. Oboho, what populations of people are most at risk for monkeypox?
Anyone is at risk for monkeypox because of the way it's transmitted. But in the current outbreak, we've seen more infections among gay and bisexual men amongst that particular community.
Dr. Oboho, how do you test for monkeypox, and what should someone do if they suspect that they've been exposed?
The decision to test for monkeypox is really based on how the person presents and if they have a story that's compelling for a link or connection to someone who's been diagnosed with monkeypox or has a rash suspicious for monkeypox, or if they had close contact with that person. Testing is done by swabbing the rash, which we also call a lesion. It's important to note that testing is not available for people who are asymptomatic or people who don't have a rash. It's important for your PCP to have the right personal protective equipment when samples are collected for monkeypox. So giving your PCP a heads up is important instead of just showing up.
Dr. Pearl, how is monkeypox transmitted?
Monkeypox is transmitted by direct physical contact with mucocutaneous lesions of infected individuals or their respiratory droplets. It's not something that lingers in air, but because they develop the rash or the sores that can be inside of the body, including the mouth, transmission via those membranes occurs. Infected individuals are contagious from the moment that their symptoms begin, and it continues until the rash is completely healed or is covered by a fresh layer of skin. The virus can also linger on linens. The role of hard surfaces is less well understood. We know it's been isolated on hard surfaces, but that has not been shown to be a vehicle of transmission.
Dr. Oboho, what patients need medical treatment of monkeypox? What makes that case mild versus making a case more severe or potentially life-threatening?
Patients who have meet the criteria for severe disease tend to have bacterial infection on top of those monkeypox lesions. They can also have a brain infection or severe pneumonia, eye infection, infection in the anal region that causes a lot of pain. The other group of people who also may have severe infection are pregnant and breastfeeding women, and then children under the age of 8 and people who have immunocompromising conditions.
Dr. Pearl, school is starting across the DFW area, and so we're hearing some concerns about transmission of monkeypox in the classroom. What should parents know?
When we're talking about the general population, which includes school-age children, while a few children have been reported to have monkeypox, this is not the demographic that's primarily involved in this outbreak. Second, schools have really beefed up their cleaning protocols. They also have more structured processes when children are sick, and they're much more in tune to physical distancing, which are, again, all important to prevent transmission.
Dr. Oboho, what's the treatment should you develop a severe infection?
I like to think of treatment for severe infection into 2 categories. And supportive care really focuses on managing some of the complications in the organ systems that could be affected. And so, because of the skin involvement, people can be dehydrated. And so, hydrating them to maintain the fluid balance that could also come from vomiting or diarrhea, improving blood pressure support, oxygen support if there's a severe pneumonia, and then treating the superinfections from the skin lesions are also important. The antivirals, which are medications active against viruses that have activity against monkeypox, the data from that comes from animal studies. We really don't have any data to say that these are effective in treating monkeypox in the current outbreak.
Dr. Perl, you both talked about the importance of prevention in sort of slowing transmission. How long should someone isolate after an exposure to monkeypox?
Current recommendations are 21 days if this is deemed to be a significant exposure, and that will be from the date of exposure.
Dr. Oboho, we're hearing a lot about the monkeypox vaccine in the media every day. How effective is the vaccine and who should receive it?
Currently, there are two vaccines that are available for the prevention of monkeypox, but we don't have any data on how effective they are for this current outbreak. This vaccine is called Jynneos, and it's actually a combined smallpox and monkeypox vaccine. It's a non-replicating live virus. What does that mean? It means that it doesn't cause as much side effects. And unfortunately, we currently have a limited supply of this vaccine, but we're expecting there to be more available in the coming weeks and months. ACAM 2000 is the other vaccine, which is a replicating live vaccine, which is more likely to cause more side effects and has more contraindications about people who should not receive this vaccine. And there's more supply of ACAM 2000, but it's not being used as much because of the potential for more side effects. And the timing of vaccination is very important. It's been recommended to be given within 4 days after the date of exposure for the best chance to prevent a disease. If it's initiated after 4 days and maybe up to 14 days, it may reduce the symptoms, but it may not prevent the disease. The other thing that's important to know is that vaccines are not foolproof, right? So people may still have infections even though they've been vaccinated. So the recommendation is still to employ additional preventive measures and self-isolate after exposure, since vaccines are not 100%.
I want to thank you both for being here and for this important information about monkeypox.
Thank you.
Thank you, Dr. Warner.
Thank you for joining us. Until next episode, stay safe and stay healthy.